I'm going to tell you.
Video and audio circulating on social media.
But GMH broke protocol. And apparently the entire place is infected.
Prompting a response from the Guam Memorial Hospital to clear up the COVID confusion.
That doesn't help us.
GMH Administrator Lillian Posadas on I-94FM's Containing COVID-19 radio show saying it was last week a patient came into the emergency room. He did not have flu-like symptoms but admitted as a result of other complaints.
So based on that information, we did not put him in an isolation room because there was no orders by the doctor to put him in an isolation room. We did, however, put him in a private room. So that kind of helps us at least contain it.
The private room was in the hospital's medical surgical inpatient adult unit located on the 3rd floor. It was only when a radiological procedure was completed a few days later that the physician determined the individual may have the COVID-19 infection. The patient ultimately tested positive, and Posadas notifying all employees and medical staff members that some may have been exposed.
There was minimal exposure to the public because the individual was in a private room with a closed door. What the high-risk exposure was, staff who had no knowledge that this individual needed to be in isolation had, up close and close interaction with the direct and close interaction with the patient. And so those were the ones who were at high risk. It's the staff.
Posadas shoots down claims that newborns were exposed.
The individual that we admitted into the private room was on 3rd floor. He did not wander into the 2nd floor to the newborn area. So again, very, very minimal exposure to the newborn. And even if you are walking through the hallway of 3rd floor where that patient was, walking the hallway, you are low risk.
Currently, all staff who had direct and close contact with the COVID-positive patient are being contacted with the possibility some might be quarantined.
Yes, our employee health nurse and our infection control nurse is working with them and processing them accordingly, and they are being monitored. And yes, if they start manifesting the symptoms, definitely they will be swabbed and they will be tested. That's part of the protocol per CDC, okay? If you are exposed, definitely you will be quarantined. But if you're not manifesting any symptoms, you can still come to work and wear a mask. Even if and if you're quarantined at home, you stay at home. But if you're manifesting symptoms, especially, if you're not manifesting symptoms, and although, you had that exposure, wear masks. And we're making all the employees wear masks. Even our admin staff, we're all wearing masks here because we don't know who we could be encountering and could be a COVID-positive person.
Posadas, in the meantime, thanks all the employees and medical staff members for their bravery, unquestionable commitment, and commendable courage, especially in this epic biological battle. Reporting for Guam's News Network, I'm Sabrina Salas Matinani.